Today, I'm going to talk about autism spectrum disorder and how it is underdiagnosed in women. This is meant to bring awareness to autism as it relates to women and young girls so people can better identify it. This will also allow more young girls to receive early intervention and have an improved quality of life. This is also to help women who may feel that they have autism and would like more information to know how it presents and treatment options. Here is what to expect in this discussion. First, I will define autism and provide the diagnostic criteria as well as examples of how it can present. Next, I will talk about the men to women ratio that is currently used in research regarding autism and how it is not an accurate representation. Then, I will speak about why women are underdiagnosed and how autism presents specifically in women. Finally, I will discuss why it is important for people to be aware of the underdiagnosis of autism in women and the effect it can have on their lives. Timestamps will be provided so you can go to the portion of the video you are most interested in. Now, let's begin with defining autism spectrum disorder. Here is the diagnostic criteria for autism spectrum disorder according to the DSM-5. Now, there are many words on the screen, and it is a lot to take in, so I will break it down for you. First, someone needs deficits in all three areas of social communication and interaction, which is the section that I boxed in red for you. For social emotional reciprocity, this is when people have a hard time of engaging in back to forth conversation, or they struggle to share their emotions or their interests. They may also struggle to share their needs and may provide inappropriate responses to questions when asked. Now, for nonverbal communicative behaviors, this is where people may struggle to make eye contact and they may not have a full understanding of body language cues, as well as they may have lack of facial expressions. Also, they may have difficulty reading other people's facial expressions as well. And if they do have facial expressions, it's mostly on, they're either super, super, super excited or they have a hard time just keeping all their emotions in. But most of the time, they have pretty flat facial expressions. And then for deficits in developing and maintaining relationships, people with autism may have difficulty adjusting to different social contexts and just making friends. So they're having that difficulty of socializing and understanding social cues, and just connecting with people. Along with having deficits in all three of those areas, a person must have at least two types out of the four of the restricted repetitive patterns of behavior, or RRBIs. So, for stereotyped or repetitive speech, motor movements, or use of objects, this could include lining up your toys, so like putting them all in a single line. This could include echolalia, which is repeating someone else's speech. So, this, for example, could be if somebody would ask the child, "Do you want a piece of candy?" Instead of saying yes, they'll just say, "Piece of candy." And that is replacing the yes for the piece of candy and to indicate they are saying yes to the candy. They also can engage in idiosyncratic phrases using normal words in an abnormal way. So let's say a child always plays a board game with their sibling John. Instead of indicating that they want to play the board game by saying, "I want to play Clue," for example, they'll say John. And they'll just say the sibling's name because they associate the board game with the sibling's name of John. Now, for excessive adherence to routines, ritualized patterns of verbal or nonverbal behavior, or excessive resistance to change. This is basically when someone has a hard time with change and difficult time with transitions. They must eat the same food every day, take the same route every day to work or school, wherever they may be going. They may have certain greeting rituals that they have to have. And they have a very difficult time diverging away from those rituals. Now, for highly restricted fixated interests that are abnormal in intensity or focus, this is when somebody has a strong attachment to like an unusual object, whether that be a toy, it could be a TV show, it could be a person, it could be songs, anything they just have like a fixated interest on, and they want to learn everything about that one thing. Now, for hyper or hyporeactivity to sensory input, or unusual interest in sensory aspects of environment. This could include feeling indifferent to pain or temperature. They tend to avert away from certain sounds or textures that may be overstimulating, or just may not be a great sensory experience for them. This could include excessive smelling or touching of objects, or having a visual fascination to lights or movement. Now, for section C and D, it is important to note that these symptoms or criteria that I mentioned previously are present in early childhood, and they have to cause significant impairment in their everyday life. This means that autism is a lifelong disorder, and it has to interfere with one's life in order to receive a diagnosis. Now, I will discuss the men to women ratio for autism. The ratio of autism for men to women has been 4 to 1 for many years. So this basically means that for every 4 men, there is 1 woman with autism. And this was calculated from population prevalence studies performed over the years for autism. Only about 1% of the world's population is diagnosed with autism. So according to this ratio, only a small portion of that number is women. But now it is time to discuss if this ratio is accurate. The 4 to 1 ratio is deemed not accurate by researchers because of the case ascertainment methods used to look at the prevalence. So here are 2 ways that researchers could gain a sample of people with autism spectrum disorder, or ASD. One way is through active case finding, which is screening an entire population-based sample to identify all cases regardless if they received a clinical diagnosis. This is where researchers will assess everyone in the population sample to see if they could have ASD. The other way is passive case finding, which is reviewing existing databases, including medical or special education records, or contacting the parents directly to survey who has received a clinical diagnosis of ASD in the population. So passive is getting everybody who's already got a diagnosis of autism, and active is actively seeking out people who may not have received a clinical diagnosis but could have autism to include into the prevalence studies. Now, active case finding is a much more reliable than passive case finding because people could be missed by special education services and medical professionals in their day-to-day life. The 4 to 1 ratio has been found due to passive case finding. So they could have missed a whole group of people who have never been diagnosed with autism. And since women are already underdiagnosed, which I will discuss why in a few moments, they could fall through the cracks in research and prevalence studies by using this passive case finding method. And the passive method is much easier to apply to find a sample for studies than having to actively go through and assess all the members of the population, which is why it is used more often to discover ratio and prevalence. Now, a systematic review and meta-analysis was performed by Looms et al. In 2017 to show that the more accurate ratio is 3.5 to 1. They looked at studies that specifically use the active case finding approach and found studies that use the most valid and reliable methods of research. And other researchers and studies that were performed think that the ratio could be even as low as 3 to 1. Now we will talk about the main objective of this discussion, which is why are women underdiagnosed with autism? Here are a list of symptoms that are more present in women with autism. They include having a desire to interact with others, having a better understanding for the need of social interaction, being more passive, but it is being perceived as shyness, mimicking people, camouflaging their difficulties, having a relatively small group of friends. They are usually taken care of by peers in elementary school, but then they are bullied in middle school, and they engage in more imaginative play, and RRBIs are associated more with people and animals. Now, some of these symptoms are a little different than how they were described in the diagnostic criteria from the DSM-5. This is because research in ASD has been male dominated. There is little known how autism presents in women because studies have always had more men than women in the sample. These research studies were trying to be accurate towards the 4 to 1 ratio, but seeing as that is not quite accurate, there is no clear determination of how autism presents in women. Since the studies are male dominated, then that means that classification and diagnostic criteria could be male dominated as well. Since some of these symptoms are not present in the DSM 5 diagnostic criteria, then women and girls are less likely to be diagnosed. Now, I will take you through the steps of why women are underdiagnosed and how it relates to the symptoms mentioned here. The first thing that can affect the diagnosis of autism in young girls is parents' expectations of them. Social abilities and empathy is reinforced because mothers tend to talk to the daughters with more emotional references. So when girls are being talked to by their mother like that, they are basically inexplicitly being told that they need to be more in tune with their emotions, engage in more social interactions, and things like that. And this would cause young girls to be more in tune with their emotions, especially in social situations. Girls are also more encouraged to engage in cooperative pretense play, which is when all the children are interested in the same activity during play. Basically, it's a group of children are collectively playing the same game together. And young girls are also expected to engage in more social behaviors from their parents, such as greeting guests, talking to others, and having empathy. If a girl is seen to be more hesitant engaging in social situations, then it is usually considered shyness when it could be autism. So, with the parents' expectations of them wanting them to engage more socially and be more in tune with their emotions, this is where young girls who are undiagnosed with autism, tend to start to camouflage their symptoms to fit what society says they need, fits what their parents want. And I will talk more about camouflaging a little bit later. Now, let's talk about teachers and school staff. These are usually the first people to identify if there are any emotional or behavioral concerns of the child and if they need any special education services. If teachers do not recognize the signs, then more young girls could go under the radar of being diagnosed with ASD. The reason why it may not be more the reason why it may be more difficult to recognize in young girls is because they have fewer problem behaviors than boys. Girls tend to be more discreet, which again can be considered to be shyness. Two studies were actually performed to look at how ASD children behave on the playground. The studies showed that the teachers expect the same behavior of autism in girls as they do boys. So basically, the teachers that were in the study expected the girls with autism to behave how the boys with autism behaved. And the boys with autism were observed as mostly staying alone in the recess yard, but the girls were observed having friends and engaging in social interaction. This clearly shows that autism presents differently in young girls, making it harder for teachers to recognize when there are concerns. This is the beginning of girls camouflaging their symptoms, which I will discuss more a little bit later. Doctors can also have a bias when it comes to diagnosing people with autism. Since the ratio is so widely known as 4 to 1, they could be more reluctant to diagnose girls with autism because they see it as occurring more in men. They also may not be aware of how ASD presents in women. There are three criteria that doctors look at for diagnosis, which is number one, being male, number two, having an intellectual disability, which is having an IQ lower than 70, and any type of developmental delays. Studies have shown that if a girl has no intellectual disability, they are less likely to be diagnosed. So, if a young girl with autism goes into a doctor's office and she has no intellectual disability, then they are less likely to be identified because developmental delays can be explanation for anything. There's so many explanations for why a child may be talking a little bit later, walking a little bit later, doing certain things of making eye contact a little bit later. And so it's less likely for a young girl to be diagnosed with autism if they are having these type of developmental delays. And along with that, if a young girl has an intellectual disability with undiagnosed autism, then that is seen as their sole diagnosis and not autism. Boys are more likely to be considered to have autism with an intellectual disability rather than girls. Now, I am bringing back this list from earlier to better explain how these symptoms come about. During elementary or primary school, young girls show less autistic traits because they have a motivation to be more appreciated and desired by their peers more than boys. Women are given more direction when it comes to social interaction through their parents because that is what's expected of them. So they have a need to interact with their peers more to meet that expectation. And a big characteristic of ASD in women is the need to camouflage their symptoms. This means that young girls or women will show their autistic symptoms less to hide their difficulties and conform more to how society says they should act. There are two types of camouflaging. So there is active camouflaging, which is using strategies to hide their difficulties, copying their peers, and trying to overcome their social deficits to seem normal and maintain friendships. Then there is passive camouflaging, which is spontaneously mimicking behaviors. So it's not actively thinking of how to interact in a social situation. Girls will form peer groups to learn social behaviors to strengthen their ability to interact and empathize with others. They will use their relationships to learn how to act properly. And examples of this include making eye contact despite it being uncomfortable for them, learning jokes or phrases to use in conversation, altering their speech volume to match that of others, mimicking nonverbal cues such as gestures and facial expressions, and not standing too close to others. By camouflaging, girls can have a harder time receiving a diagnosis because they are just better at hiding it. Now, let's talk about restricted repetitive patterns of behavior, interests, or activities, or RRBIs. There are more differences between girls and boys for this specific diagnostic criteria than any other. Two theories as to why is that girls may have less RRBIs than boys, or that they'd have just as much, but differences in the type of RRBI. With sex/gender differences, there could be different interests in objects, such as a boy with ASD could be more interested in maps, trains, or pipelines, while a girl with ASD might be more interested in animals, dolls, or singers/celebrities. These three things are more difficult to identify because girls are supposed to like playing with dolls and be interested in animals and celebrities. It's expected for girls to become obsessed with boy bands and different pop singers and things like that. So it's not something that people be aware of. To help better identify what is an interest or behavior that is an RRBI is by asking these three questions. So the first one is this activity causing social or academic problems? Is this activity allowing investment in other activities? And what happens when you prevent them from doing this activity? By asking these three questions, you can see if something may be an RRBI. They're not obviously the thing that you should depend on. You should go look into other professionals to see, but it's a place to start. Finally, I will discuss why it is important for ASD to be more recognized in women to increase early intervention. So, why should we be more aware of ASD in women? The first reason why it is important for people to recognize ASD in women is the heightened risk for psychiatric comorbidities, which are disorders co occurring together, and in this case, it would be with autism. By 15 years old, neurotypical girls are twice as likely to develop depression. So, even without having autism, girls in general are twice as likely to develop depression. And according to research, people with autism are more likely to develop internalizing disorders. So that makes women with ASD even more likely to develop one of these disorders listed here, which is depressive disorders, anxiety disorders, ADHD, OCD, eating disorders, or personality disorders. With a later or delayed diagnosis of autism, women are more likely to develop these internalized disorders since they are under constant stress to adapt and fit into societal ideals. Now, for treatment, it is important to recognize that women with ASD are diagnosed later in life, making it more difficult for them to have an earlier intervention. Like I said previously, women have more expectations of men when it comes to societal standards, which makes diagnosis difficult. More emphasis is put on women and young girls to engage in relationships with others, invest in their own appearance, and a responsibility to chores and childcare. These expectations make it more likely for them to camouflage their symptoms to fit into those societal ideals. Women with ASD also find it difficult to gain treatment because medical professionals tend to deny the presence of their ASD. This leads them to increase internalizing negative emotions and shame, which results in them engaging in toxic relationships and depressive thoughts. Women with undiagnosed ASD have an increased chance of being in abusive relationships and have a decreased self worth. This is where it's important for them to gain an early diagnosis to better understand themselves and engage in cognitive behavioral therapy with mindfulness strategies. CBT can provide a space for women with ASD to talk back to their inner negative thoughts to replace them with healthy beliefs about themselves. With mindfulness, women with ASD become more aware of their automatic thoughts and view them critically to restructure them. For example, the automatic thought, I'm a bad friend, which is a negative, intrusive thought, can be reshaped through cognitive behavioral therapy and mindfulness strategies to just because I am tired to meet my friend for coffee, it does not mean I'm a bad friend. My friend understands that my sensory system is overwhelmed and I need some time for myself at home. The earlier the treatment, the better for women with ASD. They will be able to learn to self advocate and safety skills for interpersonal relationships, and women are more likely to put their needs second. So, learning how to self advocate is important for the internalizing emotions a woman with ASD may feel. This would lead to them having an overall better quality of life. For pharmaceutical interventions, there is no research on how medication responds to the sex differences between men and women when it comes to ASD with comorbid disorders. Since women with ASD are at a higher risk to developing comorbid disorders, there needs to be more research on effective medication and how it will affect women mentally and physically. Symptoms that are common to pharmaceutical interventions are inattention, hyperactivity, aggression, impulsivity, self harm, depression, anxiety, and mood swings. Another thing that is important to mention is that the most effective treatment for ASD or autism is behavioral intervention and not medications. Although a medication that is approved by the FDA that is used for treating irritability in children and adolescents with ASD is aripiprazole. Now, aripiprazole is an antipsychotic that activates the dopamine 2 receptor, which can decrease prolactin levels. Most other antipsychotics used normally block the dopamine 2 receptor, which can cause an increase in prolactin levels. So, an increase in prolactin levels can cause swelling of the breasts, which can be more problematic for women, obviously, because breast cancer and other things of that variety, and other medications such as valproic acid to treat bipolar disorder that is comorbid with autism can cause increase of cysts on a woman's ovaries. Now with cysts, women can experience irregular menstrual cycles, infertility, excessive body hair, obesity, heart disease, and diabetes. Other medications used to treat autism can lower the effectiveness of the birth control pill as well. And it is important for more research to go into how medications used to treat ASD with other comorbid disorders can affect women's overall being and health. To end this discussion, I will go through some final points and review what has been discussed. Overall, people with ASD report a lower quality of life than those who are neurotypical. The earlier a diagnosis can be made, then the better a person's life could be. This is why more research is needed with women who have ASD because the diagnostic criteria is formed based on male dominated research. By having more research, professionals have a better understanding of how autism presents in women and young girls, which leads to earlier diagnoses. For a woman to gain a later diagnosis of ACD, it can be quite difficult because it is hard to gain a valid and reliable report of information. The older the woman gets, the harder it is to provide accurate developmental history. Their caregivers may no longer be alive to provide details of their childhood experiences, or there could be a loss of memory from being so long ago. This creates difficulty for women to gain a diagnosis of autism later in life because to meet the diagnostic criteria, all the symptoms need to be present in early childhood according to the DSM 5. With earlier diagnosis, then women with ASD can receive early intervention. Early intervention treatment can lead to less women feeling shame and internalize negative emotions to form healthier relationships. Women with autism will experience less victimization when it comes to their interpersonal relationships, and since neurotypical women are at a higher risk of developing depression and people with autism are at a higher risk of developing internalized disorders, then women with autism have a higher risk of developing comorbid disorders such as depression or anxiety. With an earlier diagnosis of autism, then the chance of developing internalized disorders would decrease and would be offered treatments such as cognitive behavioral therapy, mindfulness, and medications. Although more research is needed to know what pharmaceutical interventions are safe for women, there are many medications used to treat autism that could be harmful to a woman's body. A struggle for a woman to get diagnosed with autism is due to the fact that they are not male and may not have any intellectual disability. Most research on women with autism is mainly focused on women with autism and having an intellectual disability, when there could be many with women who have autism but no intellectual disability. More research is needed for professionals to understand how autism can present in women without an intellectual disability. I hope you have gained a better understanding of how autism presents in women and why women are being underdiagnosed from this discussion. If you feel you or someone you know may have autism after listening to this presentation, then there are resources linked below to help guide you to diagnostic procedures and clinical help. Also, I provided my references here if you would like to look into the research and literature yourself as well. Thank you for your time and listening.